If you go to YouTube and type in how to improve posture, you'll find a lot of the same explanations. You'll find pec stretches, scapular retraction exercises, and chin tucks. While although these exercises may have a time and a place, they all come from the same belief. That belief is that the best posture is usually synonymous with an upright military type posture. And so in this video, I want to discuss how we can start to change that belief and create a postural paradigm. A paradigm that changes that belief to give us a better and different outcome. The first step to improving posture is to change our belief. Usually the current belief is that when someone says good posture, the visualization or the thought that comes with it is an upright military-like posture. And on the other hand, when someone says that person has bad posture, we usually visualize someone that's more slouched over. Now, what I want to do is change that belief. And I want you to think of a good posture defined as someone that has movement variability. So that means that this person can move in and out of different postures all day long. And I want to change the belief on bad posture. Essentially, I don't want you to think about a certain posture as good or bad. I want you to think that when someone is stuck in a certain posture, that's what's going to make it bad. When someone can't get in and out of those different postures, they're in a pattern. And when someone creates a heavy, dominant pattern, they're going to have unfavorable outcomes, i.e. pain, i.e. restrictions, i.e. decreased performance capacity. The second step to improving posture is to identify your specific patterns. Now, there is a lot of different tests that can be done for this, but I wanted to just provide a simple framework so that we have at least the foundations so then we can start to improve upon that. So the first thing I want you to start to look at is your infrasternal angle. And that's this angle you see here. Essentially, it's the lower rib cage coming up to the xiphoid process. Now, in a nutshell, we can have a wide or narrow infrasternal angle. And what's going to happen as a result of that is it's going to provide us better movement in one direction and limited movement in the other. Now, I have a whole course that goes into this into significant detail so that you can really provide your patients the best possible outcomes. And I'll leave the link to that in the description below. But for the basis of this video, I want you to understand that when the angle is greater than 90 degrees, so greater than what you see here, usually your patient or client is going to be in more of a flared ribcage position, in an anterior pelvic tilt, and in an extended overall posture. Conversely, when someone's more at this 90 degree or less, so something like you see here or smaller, then the rib cage is usually more down, the pelvis is normally more tucked into a posterior pelvic tilt, and they bias towards external rotation and flexion range of motion. So what does this ISA tell us? Well, it gives us the basis as to their starting point, and essentially all we want to do is to get them good at what they're bad at. So we said our wide, greater than 90 degree infrasternal angles are going to bias more extension. So we need to provide them more flexion-based exercises. And then for our narrows, like we said, are 90 degrees or less at the ISA. They are usually more flexion dominant, and we need to provide them more extension to move them in the opposite direction. The next thing I want you to check out is breathing. When your patient or client takes a breath, do they have the ability to expand the chest in this anterior to posterior direction? Or do they only have the ability to do a belly breath and they cannot expand here? Now, what I've found with this is that when a patient has the ability to expand here, they're usually in a less of a patterned position, meaning that they're not as stuck compared to someone that cannot expand here. Because if you think about it, when someone can't expand here, there's way too much compression going on. The muscles are concentrically active, they're compressing, and they're going to limit the ability to breathe to rotate and to really move optimally. And so with that, you begin to get more stuck, aka patterned, and it's harder to get out of postures at that point. So I think it's a relevant test to just check your patient's breathing. Again, when they take an inhale, can they expand the chest? Great, if they can. Do they just get the belly breath? That's fine. We might just have to work with them more to improve their overall ability to expand up here, and you'll start seeing better postural outcomes from that. So to keep this video short, those are two great ways to start to understand your patient's biases. Again, if you really want to dive deeper, I would check out the Performance Redefined course, where we go over all of our lower extremity assessments and all of our upper extremity assessments. And what this does is this allows you to get a lot more intentional with your exercises to improve your patient's overall structure, pattern, and postures. The third and final step to improving posture is to improve movement variability. Essentially, that means get the patient good at what they're bad at. Move them in the opposite movement direction. And so I want to make a disclaimer, and that disclaimer is that we've talked about the principles. And I want you to remember that the principles are really the guide to choosing the best exercise. Now, with that said, I want to show you two exercises for each archetype, the wide and the narrow. But just keep in mind that it may or may not be the best for your patient depending on what is going on with them. What I'm doing is following the principles and giving a general statement as to, for this, how a wide ISA could really benefit from this exercise. All right? Now, with that said, what did we say the principle for the wides are? We said that they love extension, they love a flared rib cage, they love an anterior pelvic tilt, right? So all we're doing is giving them what they don't have. An easy exercise is a deep squat with a TRX and essentially breathing. What this is doing is the slant board in a heels elevated position biases a posterior pelvic tilt at the pelvis. We are going to be in a very rounded position, as you see. So we're moving them away from extension into flexion. And then the TRX gives a nice lat stretch because usually those are very, very concentrically biased. From here, all we do is breathe. So we go into this position, make sure that their head is not up, their chin's down, and then we're just going to cue our patient to inhale through the nose, exhale through the mouth. Now, what I will say is that as they inhale, you shouldn't see them rise. A lot of times with wide ISAs, as they inhale, they'll start to move back, they'll start to lift. This is that extension bias trying to come out. So we need to remain nice and flexed and rounded and externally rotated as we go through our breathing exercises. Next exercise is an isometric foam roller hamstring curl. And this is great for those wide ISAs that love extension, because when we're in extension and an anterior pelvic tilt, the hamstrings have a ton of length, right? That's a really direct outcome from an anterior pelvic tilt. And so what this exercise does is it forces them to go into a posterior pelvic tilt and then concentrically or shorten the hamstrings. So again, what is it doing? It's pulling them out of their normal pattern or posture and moving them towards the other. I love isometric exercises to do this because since that patient isn't moving, they're not actively going through knee flexion, knee extension, they're just holding, they can really focus on position, aka their posture, and become more aware of that, right? So pretty simple exercise, but really good bang for your buck because a lot of patients really feel it. What you want is a ball between the knees. We're gonna go down in a hook lying position with our feet on the foam roller. Start with your heels on the foam roller because we want to end at the midfoot. From here, all we're doing is going into that posterior pelvic tuck, so make sure they know how to do that. We're going to maintain that position, so we want to feel like we're swooping here. We have this position, we're going to maintain the tuck, we lift, we then pull back till we get about to our midfoot. That's the internally rotated bias position. And then from here, we get a gentle squeeze on the ball. We give gas pedal with both feet so that the ankles aren't super tense, and then we hold this for X amount of time. So now we're taking the same thought process, but for those that are more on the narrow ISA side, or someone that biases more external rotation and more of a flexed posture. When it comes to the first exercise, I always want to incorporate breathing and something that's moving them away from their current pattern. So this is the exact opposite from what we saw with our wide ISA. So for a narrow ISA, TRX is here. When we are in a posterior pelvic tilt, there's tons of compression back here, right? So the muscle is pushing them into this forward hunched position here. So what we want to do is start to have our patients in a position where they can elongate these muscles as they're starting to breathe. So super simple exercise, but the principle and the intent behind it is what really matters and what ultimately is the difference between getting someone results and not. So what we'll do is all we're going to do is be in this position. We're just going to hinge, right? So we're hinging back. They're pushing the butt back. The knees aren't really bending. We're getting in this extended position through the spine and more of an anterior pelvic tilt through the pelvis. And then all we're going to do is breathe. Inhale through the nose, exhale through the mouth. With our narrows, we want to take more of fogging the glass types of breath. So compared to like a pursed lip type breathing or a balloon breath. So a little bit more open mouth breath. And then we're just going to breathe in this position with our head staying nice and down. So the next exercise is essentially the same as what we just did, but instead of a breathing focus, we're now focusing on the performance side. Now, it might not be every day that someone tells you that a deadlift or hinge variation can improve posture. But remember, you have to remember the why. What is the intent behind the movement? Well, the intent is to get this person more extended and internally rotated because they like to be flexed and rounded over, aka a squat. So we need to get this squatter to move more like a deadlifter, right? And that's how we improve posture. Why? Because we've improved their movement variability. So as it comes to the deadlift, it doesn't matter if you do this body weight with kettlebells, dumbbells, barbells, band, cable, whatever is best for your patient, but getting them to really push back to not bend the knees is what we're looking for. And essentially tell your patient to really keep the knees over the ankle, right? Not in front of the ankle, that's a squat, but pushing back, sliding the dumbbells down, feeling the hamstring, and coming back up. So again, really important that when we go through the movement, we're not getting them to go into their normal squat flex position.